Welcome back. So one of the highlights for those that have attended SLIF live in the past is we always have a state of the industry discussion where we like to have CEOs and leaders from the industry to kind of talk about where things are headed. And it's always been a provocative discussion. And at our first Senior Living Innovation Forum in 2015, the moderator was Ryan Frederick with Smart Living 360. Did a phenomenal job, and I've been trying to get him to come back for the past few years, and he couldn't make it work. This year I said, dude, you don't have to get on a plane. You just got to turn on your computer and your webcam. So he's agreed to join us. Ryan, you there?
I am. Thank you, Michael. Thanks for being me.
Yeah, and we're both in Austin, Texas. So I was saying, joking, we could have actually saved some bandwidth and done this together, but that would have been a little weird, I think. But excited to have you joining us here today, and we've got a wonderful panel. I'm going to pass the baton to you here. So we've got about 50 minutes to talk about a lot of things, the state of the industry with the theme of where we headed. So I'll pass it to you now, Ryan, and you can welcome the panelists, and I'll come back at the very end to tell you when time's up. So, but for the audience, just before we do that, encourage questions and chat in the chat function of the Hopin platform. There are also, if you have not seen already, there are a few poll questions there. And I can actually see the results right now. There's a question on, is your organization prepared for a second wave of COVID cases this winter? 100% of the audience are saying yes, so that's obviously great news to hear. And then we also asked, what is your biggest challenge at the moment? Hiring and staffing, census, funding, morale, or other. So we're getting some responses in there with hiring and staffing at the top of the list, which is not a surprise. But just want to share that with you, Ryan, because I know you can't see that right now in the platform that we're feeding into Hopin. So, but without further ado, I'll hand it to you, Ryan, and good luck, man.
Awesome. Well, thank you. Thank you for including me. I'm looking forward to this panel. Jason's a tough act to follow. I don't have any props. I don't have a teddy bear, but love the energy and love the perspective, because in a sense, that is where we are. This idea of how do we reconsider the impossible in a challenging time, and how can we imagine ourselves in the future and then work our way back. And fortunately, we've got three thought leaders and CEOs here as part of our where do we go from here discussion. Bob Kramer from Nexus Insights, Tom Grape from Benchmark, and Dwayne from Aegis. So I welcome the esteemed panel here. Yeah, gosh, it's great to be here virtually. It's too bad we can't be in person though. But great to see each of you. This is an unusual time. I know each of us have talked about new models for a while, and in some ways we're being thrust into it. There's what Michael said moments ago in terms of the interest on culture and staffing. I know there also was a survey that Michael sent out in advance to get people's feedback in terms of what people are interested in. I also know that occupancy and census was actually the top thing, previously. So there's four pieces that I'm looking forward to touching on with our panelists, and we have about 10 minutes for each. We do want to talk a little bit, what is it like living with COVID now in this period, and how long this period may last. I know Tom and Dwayne have been doing some interesting things in their organizations to thrive during this period. And then I want to take a moment to talk about rethinking the value proposition. What really is the reason why people should come into our communities, and what could be done to strengthen that, communicate it in better ways? And then we're going to talk a bit on the hiring and retention side and the culture. I know Dwayne has a number of thoughts in that area. And we're going to finish off, in a sense, going from where Jason left off, which is, what are these models of tomorrow? What does growth look like? How should the model change in more material ways? So with that, why don't we kick it off? I'll pass the baton here to Tom. Tell us a little about your perspective, Tom, and in this thriving and surviving during this time of COVID with your organization at Benchmark.
Well, it's been quite a ride. We were obviously all trying to figure it out in April, May, June, and since then we've been continuing. We didn't sort of let up after the first wave subsided. We've been continuing to press on and learn more and prepare further, and in anticipation of the second wave, which I think we're now beginning to see, we're beginning to feel here in the Northeast as the cases rise again, and our states and towns are starting to get to higher levels of concern. So we've been doing a lot of preparation to further batten down the hatches. But we've got lots of issues that we're concerned about. Most notably is staffing. Our morale is, our folks are just tired. They're tired of wearing PPE. They really killed themselves during the months of April, May, June, and we've been encouraging everybody to take time off, and we've been doing a lot of recognition events and appreciation events. And but folks are tired, and everybody's tired of living with COVID and all the restrictions that's put in all of our lives. And so we're doing all that we can to prop people up and remind them of the purpose of why we're here, and that helps a lot. But it's folks are tired. I think so. That's been a challenge. I think recruitment. On the one hand, we all thought we might be able to steal a bunch of folks from the hospitality industry when it faced its challenges. We found that to be less fruitful than we might have originally expected. I think third, the challenges of state restrictions on visits and group gatherings and the like has posed a challenge. Families aren't wild when mom moves in and all of a sudden has to be quarantined, or whatever the various restrictions might have been. And we're hoping we've been working hard to try and influence those restrictions being different next time around. But we're certainly a lot more prepared as an industry and as a company for this next surge than we were first time around. And I think we're confident that the incidence of positive cases or fatalities will be very different than it was in the spring.
Tom, one more follow-up question to that. I'm curious, how are you managing expectations? We talk about the second wave, the fatigue that's happening. Are you projecting an end in sight, or is this a marathon with an uncertain finish?
Yeah, when folks after in say June were talking about returning to normal, I at least was one saying I don't think we're returning to normal anytime. I'm not sure we're ever returning to normal as we knew it before, and secondly, I didn't think it was happening anytime soon. And I'm still of the view that we're a couple of years away, whether there's a vaccine in the next few months or not. I think it's a couple of years of living with this in some form or fashion. I think we're with PPE for a long time. I think COVID's with us in various forms for quite a while. So I'm of the view this is a long haul. This is a marathon, not a sprint. And I've been communicating that to our teams and to our residents and families, not trying to bring people down, but trying to set realistic expectations that this is with us for a while.
Thank you. Dwayne, I'm curious, I'd love to have you share with our audience how you've approached it. I know Aegis in particular has been really focused on getting research and scientists together to get the latest on the disease as well as the vaccine. So I'd love to please share with us where you are in that process.
Yeah, I think, first of all, I think there is traumatic and dramatic as this pandemic is. I think there's going to be some good that comes about it, because of the strength of our industry. First of all, I think all what I call the posers or the pretenders who wanted to be in our industry are going to get out, because this is a tough business right now. And if you weren't 100% committed for the next decade, you're probably not going to survive that. So I think that's a good thing. I think also, we've seen over the last couple decades, my comrades on here on the call, I think we've all known each other over 30 years. I'm the youngest, I think, I was in it when I was 8. My colleagues are a little older than me, but my good friends. I think the good part about this is that we're going to see more medical technology and science enter into this industry, where we can really start taking care of people medically. And not like a nursing home, not like a hospital, but we'll have more medical interventions. And I know, we're looking at hiring a physician now in-house. We had one up until a year ago, more nurse practitioners instead of just RNs. But aligning ourselves with medical institutions. We got COVID very, very early. As you all know, the nursing home in Kirkland, Washington, which is 8 minutes from our corporate office, and we have 4 buildings within 10 minutes of that nursing home, was the initial outbreak. Seattle was the initial outbreak, had the first death in the United States. And on February 28th, which was the first death in the United States, we had a staff member enter our building with COVID. So we were hit super early and super hard before anyone even knew what COVID was. And that led to, about 28 people in that building getting it, which was a disaster. Since then, we've had less than 70 residents that have gotten it in the last seven months. Today we have 8 cases, all staff, no residents that have it, out of 5,000 staff and residents. So I think because we've really focused on the science and the data, and we've aligned ourselves and conferred with people like the Gates Foundation, the Fred Hutch Society, the Institute of Disease Modeling that's providing all the information on modeling with the White House. And then we formed a virus council that has physicians on it, scientists that are working on the vaccines, ER doctors that are seeing triage cases every day, geriatric physicians, psychologists, naturopathic doctors, Chinese MDs, so we could see what we learned in China when the disease spread. And all these people have influenced to a great extent about our tactics and our strategy of what we should be doing. And we feel fortunate that although, we've had 90-some residents that have had it, it's been a lot better than a lot of people. And so we feel fortunate that. And I think that's just going to drive us towards more technology. We use a ventilation system called Molecule. It's the only ventilation system, they're portable, that the FDA has given a letter of encouragement to. We use a disinfectant wand called the Viking Pure that Alaska Airlines baseball teams are using right now. We're reconfiguring our ventilation systems in our new buildings where we're using condensation to provide better oxygen in the building. So again, as much as we want to say it's all doom and gloom, and I absolutely agree with Tom, my cohort here, that we're getting information like the day it's going to the White House. We're in for a very dark winter. I wish I could be more positive, but we're going to see things far worse than they were this summer. And even if a vaccine comes out in December, like Fauci says, our residents need a very specific type of vaccine, which generates the immune system, because you can't typically take a normal vaccine. So it's got to be an antigen vaccine that improves their immune system, that allows them to take the vaccine. And then to vaccinate the number of people that want to be vaccinated, even though healthcare is now the number 1 priority, it's going to be months. And, it may be next summer when it will feel like normal, but people are still going to wear PPE. You're not going to shake hands and give people hugs. So I agree with Tom. I think it's going to be a couple years before the virus runs out of steam.
Thanks, Dwayne. So Bob, what do you do here? We're in a situation where it's not a quick change. It sounds like, based on what our panelists are sharing, we're called a couple years before it might return to some level of normalcy. But to Tom's point, it's not the normal we came from. I know your interaction with a number of leaders throughout the industry. What would your advice be here for living with COVID and helping keep the morale, high, recognizing the uncertainty we're facing?
Well, several things. First of all, I very much agree with the comments of Tom and Dwayne. And, this is, it's not only a marathon, but it's a marathon where the finish line, in a sense, keeps moving, and that's very hard for people. But a couple of things I would stress. One is, ironically, the public's reaction, all of our reactions to the quarantine of the pandemic, has actually reaffirmed how much we long for social connection and contact. And while the virtual is better than nothing, it is a substitute finally for the real thing. And so I would argue, as we think about the future, that we can see the opportunity we have to take the 22-year-old frustration with the failure to be able to get together for some beers with some friends even though he or she can Zoom all the time. They want the real thing. And if we're doing what we should be doing in our communities, we're providing that real thing. For now, we're having to do a lot of it virtually. I mean, I think Jason's comments beforehand, this has forced the healthcare sector to consider the impossible as now the doable. Look at telehealth, as Dwayne has suggested. Look at the integration of medical services, basically bringing healthcare services to our residents where they live, rather than sending or shipping them out for their healthcare. Enormous opportunity, I think, for our sector. So I would sum it up in we have to, what Tom and Dwayne are doing so well now, we have to manage the current crisis, but at the same time, we have to be anticipating and planning for the future. And it's going to look very, very different. And it's birthing all kinds of possibilities. I mean, NIC's been talking for a number of years, especially through our spring event, about the integration of healthcare and senior living. And it's always seemed to many as kind of way out there, as yes, but that'll be in 5 to 10 years. It's not really, doesn't have to be on my radar right now. I would argue that, as Joe Coughlin likes to say, one of the things that's happened in COVID is that it has propelled us faster into the future. And part of that being propelled is understanding that that fear of going to the hospital, of the emergency department, of the doctor's office waiting room, that isn't going to just disappear in a couple of months or even when there's a vaccine. And so I think we're going to be thinking totally differently about our setting. And I think our residents and their family members are going to be, the bar of expectations been raised, both on infection control and prevention, on managing chronic conditions and triaging on site, and finally, on delivering the reality of a sense of purpose and engagement and social connection. That is the ultimate value proposition of the congregate setting.
Well, let's shift into that. I went on a walk. So we have 3 teenagers going through this COVID experience, and they went back to school last week. And I went on a walk with our daughter, who's a sophomore in high school, and I asked her last night, well, how is it, this virtual versus in-person thing? And she said it makes all the difference. Like, she just is so excited to be back in school, and with some of her friends, about half the kids are there, and she's a couple friends have had to disappear because they've been quarantined because they're around someone that got COVID. It's part of this, the reality that we're in right now. So I want to talk about this value proposition that Bob just alluded to, and in the context of this idea that we have this prolonged period, uncertain. I've only made it to a half marathon, and thank goodness they didn't move the markers on me. But that was long enough. But I wonder now, you almost have to have this value proposition during this extended COVID-19 era, and then you have the value proposition post COVID-19. And I would love to hear how we're looking at this. Bob, you shared some ideas, but Tom, let's go back to you and remind people what types of communities you have, in the Northeast, independent living, assisted living. Just help us understand the perspective that you bring on the value proposition side.
We have 61 communities in 7 states in the Northeast, and it's predominantly assisted living and memory care assisted living, a few CCRCs and a little bit of IL, but it's predominantly AL and memory care. I totally agree with Bob that the opportunity here, particularly for folks who've been at home, whose adult children have been at home, and be looking after mom or grandmom, and have seen how compromised she is and how much help she needs, or have been providing more care and realizing how valuable a senior living setting would be. We find those folks eagerly looking for communities like ours. And at the same time, there are other folks, though, who are concerned about any sort of congregate or group setting, given what they've heard about, about what they've read in the press, about what's been happening in nursing homes in particular, or senior living to a lesser extent. And so the proposition, the challenge that we all have to overcome, of course, is getting back past the trust factor of being able to convince people that it's safe, that we have the infection control and proper healthcare precautions that they can move in order to get the benefits of the social connection and human connection. And that's not a hurdle we really had to cross in prior to COVID. And so I think things like transparency and being open about what your practices are and being clear with what your what steps you've taken and the like, I think are obviously parts of the solution for that. But that's a step that we didn't have to take in prior days that we're having to obviously take now. But I think totally agree with Bob that the social connection, if anything, has been really reinforced the importance of it in these days when folks have been isolated or quarantined to various degrees.
Are you finding that the sales cycle is longer now, Tom, from when people reach out, or is it largely the same? It's just a different set of questions.
We're finding it to be sort of the same, although again, it's sort of interrupted because depending on whether we've had to close a community for a little while given state restrictions, or whether folks have had to quarantine or the like, it's sort of not really. It's a little hard to compare actually, but generally it's about the same, but it's a different set of questions.
Dwayne, how about you? You clearly have invested a lot in the dimensions related to the virus and potential vaccines, and you brought in, it sounds like, a team of experts to advise you with your counsel. What is the value proposition, particularly during this 2-year window, and how do you see it shifting? And I say 2-year loosely based on our dialogue, but during this more extended window, how do you see it shifting, afterwards?
Well, I don't, there's been a lot of discussion about, is this going to take the shine off the apple for senior housing? And I don't think it's going to take the shine off the apple for senior housing long term, because the demographics that we're approaching here in the next 5, 6, 7 years are, we're going to hockey stick through the ceiling here. And it will get to a point where there's not enough supply to meet demand. And so, yeah, I totally agree with Tom. You have to pivot. You have to do things different. And the families still want to move in. The value proposition of moving in to a 14-day quarantine is not very appealing for anyone. It wouldn't be appealing for me. But we have huge desire there. A case in point, a proof point, is we have a building opening in 10 months in Kirkland, Washington. It's 25% pre-leased, so the demand hasn't gone away. That's very unusual for us, and that's an assisted living memory care. But the thing I want to change the narrative here a little bit, because I think Bob struck on a super important chord. I don't know that everyone gets, and that's how we deal with, and Tom addressed this, the mental fatigue, the emotional fatigue, the morale of our staff. Because this has been going on for us for 8 months now. This goes on another 2 years. We're going to have to be super creative leaders in how we motivate these people. We have the food trucks pulling up and we're doing parties for people and everything else. But we've had to employ some different kind of things. We hired a psychiatrist that does remote sessions for people and comes on and does Zoom calls like this. I personally teach a meditation class on Zoom to over 100 people every 2 weeks for our staff. We had to enact a telemedicine program for everyone so they didn't go to the ER if they got sick, that they could talk to a doctor in 3 minutes both logging on. We had to provide food for people. We had to look at childcare needs. Right now, we're looking at starting a tutoring service for staff that we can help tutor their children at home with our own tutors. So you have to be, I think you're going to have to go to extreme lengths to really help the fatigue and the morale of these staff. And yes, the residents, have that same problem, the same mental problems, but you got to fix it with the staff first, because if you don't fix it with them, you don't have a business. I think I've shared before on a couple of these kind of calls. In the last 8 months, I've heard of 2 nursing homes where the staff just walked away from it. I've done this as Tom and Bob for 30-some years. I've never in my career heard of a whole staff just walking away from a building. It's happened twice in the last 8 months. So, that is that's indicated of what kind of culture you have, what kind of staff loyalty you have, what kind of leadership you have, the relationship that you have with your staff. That's critically important to get you through these tough times.
As a shift back to you, Bob, one thing I want to point out is sometimes we use senior living as this umbrella term. And there's a lot of different types of products and experiences under that umbrella. And you have Dwayne with Aegis and the subject matter expertise largely in assisted living and memory care. But on the other hand, you have life care communities or active adult communities where the staffing model is typically less as people are healthier, and it's actually more resident driven in the piece. So it's not just the morale of the employees; it really can be the morale of the residents. So, Bob, I'd like to go back to rethinking the value proposition, but more from a healthier, younger resident. And also, is there an element where we can make virtual actually be an asset in a virtual world? You could just tell us a little bit how you think about that along the lines of purpose and so on.
Great question. I do want to just put in one short comment on what Dwayne has just said, because I think it is so important. I would say that crisis reveals the strength or weakness of one's culture. And I think right now, as Dwayne said, our frontline workers are key, and the exhaustion, the fatigue. And so I would just say three things I think are critical. One, that management at all levels is listening to those employees. Two, that they're hearing them. And there's a difference between listening and hearing. And they're hearing their concerns, the things that are on their minds when they come to work or when they leave to go back home. And lastly, that they're acting, that management is acting in a way that doesn't solve all those issues or problems, but shows that we want to care for you as family, just as we're asking you to care for our residents as family. And I think that's critical. I think providers, leaders that are doing that, they inspire their staff to hang in there, because as Dwayne has said, and Tom, this is going to be a long slog. It's not a short period of time with a definite end in sight. Now, to your question, Ryan, I think part of what this has brought out is the importance of segmenting our market and understanding the difference. I was going to say in one of the points earlier is I think one of the challenges, and this has been a wake-up call in a certain way to particularly assisted living and even independent living today, which is the assisted living of 5 to 10 years ago. And that is we've never gotten over sort of the ease with which we competed against nursing homes, said we weren't like them, we weren't institutional. And on top of that, we then followed the acuity creep in our buildings of residence, so that more and more we were selling needed care, and we weren't putting as much emphasis on the lifestyle. And now the bar has been raised on prevention and on infection control, but ultimately we've got to be delivering on the lifestyle. And right now, I think for boomers, as they're looking at this, for many boomers, let's be honest, their sense is, I want to live my life in a way that I can avoid ending up in a nursing home and having an outcome like what I'm reading about in the newspaper. And so we're going to have to be providing them a lifestyle product, which I think means, among other things, it is something where they have a feeling they have a control over it, which means it's not packaged, it's not bundled. It means it uses technology to give them that sense of customized, personalized experience and that sense of control. So, we're not directly necessarily providing this boomer at 74 healthcare, but we're working with them as they use their Apple Watch, their Fitbit, or whatever, to be able to, in essence, use technology to accomplish goals they want to accomplish for their life, which involves, among other things, wellness and prevention matters and so forth. I guess putting it in a crasser way, perhaps to just generate some good discussion amongst all of us, I think for many boomers, they look at senior living as senior dying. And they want to figure out, what's my lifestyle going to be that I can avoid that outcome? And I think we have an enormous opportunity to provide that product, but it's not assisted living because boomers aren't going to need that product for 10 to maybe 15 years for the most part. And we have an opportunity to think about a different product that's that enables boomers to create those personalized, customized experiences versus one size fits all, has heavy use of technology, and particularly, therefore, provide something that fits the boomer sense of what they aspire to with these bonus years or whatever you want to call them. And that has to do with their sense of discovery, but ultimately with their sense of sort of refiring and reforging what they want to do with this next period of their life. So bottom line, it's creating something that's aspirational, not something you're trying to avoid at all costs. And it's offering a lifestyle, which I think we're seeing, and even what we've seen in terms of the use of virtual. I would argue our industry, thank goodness, has been brought into the 21st century world of digital because of COVID, big time. We've had to learn to communicate, we've had to learn to deliver care, and we've now have to learn how to deliver social engagement and connection, all virtually. And that means we'll be better suited to be able to serve the boomers in the future.
Yeah, I mean, I think a couple things on that. You've got where you are right now with our existing product. And one of the things that's come up is we all are craving this social interaction. I heard it loud and clear from my daughter the other night, and the difference that it makes. And so it's a reminder of that. And there are some benefits when it's robust virtually. I know there's, in the strategy consulting practice I have, there's one client in particular in Florida that's been quite effective in transporting or transforming a very robust, normally in-person resident engagement platform and making it virtual. And it's made a difference. It's substantially better than people in their homes. And that's been enough for some people to want to move in, even in this virtual environment. But I think there's one of the things that happens is, how do you make the best of what you currently have? And like Bob said, I think it also is an opportunity for people to consider, what should the future look like? I was just on a call earlier today with a group, not-for-profit in this case, and they had board members who were boomers. And they're saying, we don't really want to go to what's there right now. How can we help figure this out together? So, there's a thirst to figure it out, even with people that are serving our industry, indirectly. I want to go back, Tom, you made a comment earlier about there's all these people in the hotel industry, and obviously hotels aren't, most of them anyway, aren't very active, certainly than they used to be, and therefore you've got these pools of people that should be available. And you mentioned that was attractive, yet it may have been fool's gold. It hasn't materialized how you anticipated. Tell us more about that. Why hasn't that materialized the way you hoped?
Well, I think there was, when all the dislocation happened in the hospitality industry in the early days of COVID, there were, a lot of layoffs and furloughs in the hospitality industry, and a lot of folks sort of thought this would be a, recruiting boon for senior living. And that may have been some folks' experience, at least in the Northeast. That was not a widespread phenomenon. Obviously, there were exceptions, and we were able to get some great folks, but it was not the widespread, massive hiring spree that some folks thought it might be. I think probably partially because those folks were reading some of the headlines about what was happening in the nursing home business, and maybe not being so attracted to the care side of things. But I think there were some great folks we were able to get. And I think, again, focusing on the purpose of what our business does, and folks who are attracted to that were the right folks to get, not just people who were looking for a job. We didn't want those folks. So I think it was probably not bad the way it turned out. We didn't want anybody who's just submitting a job application. We were the folks who were drawn to the purpose and meaning of what we do. But it was just a different. I think there was a lot of articles about the recruiting boon this is going to be, and at least in this part of the country, that didn't turn out to be the case on a widespread basis.
Well, I mean, it is an interesting phenomenon, right? We have this situation where unemployment's high, where there is meaning in purpose and meaning that happens as a consequence of being in this field. There's a need for jobs. Staffing has been a challenge for our industry for a while. You would think that it wouldn't necessarily be the biggest challenge at the moment. I know staffing comes in a lot of different forms, and the hiring and retention, but it remains a challenge. It was mentioned, Michael, to kick this off, the highest thing that came up in the polling, and part of Bob's point, and even I think to some degree Dwayne's, we expect and demand a lot out of people. I mean, Bob's point, we should listen and act like that's true. It's just hard to find people that operate that way. And we're all under a lot of stress right now. I mean, we're almost suggesting that we all have to be superhuman for another 2 years. Help me, Dwayne. I mean, you're doing some clever practices, but just going back to this hiring and retention thing, at some point when we say more, there's nothing there.
Well, just to leapfrog what Tom was saying on the hospitality thing, we saw a surge in general manager applications from the hospitality industry. It probably went up 3x over what we'd seen in the past. The thing you have to realize, the hospitality companies were not furloughing their exceptional employees, right? They went down a pecking order, and the people who weren't exceptional, they furloughed. So you have to be discreet and discerning about who you hire out of those people. I think we picked up probably 3 or 4 general managers, but the thing we saw absolutely no lift on was the line staff. And, there was absolutely no, in fact, it got worse. And it got worse because everybody needed those people for line staff jobs. So that's the challenge for us. And I think, our industry as a whole has always been a difficult challenge recruiting. 85% of our general managers come from the hospitality industry. So it's always a challenge to kind of present this brand to them, or this life of how your life is kind of the same but a little bit different with the medical aspects. I think in the media, the cases of COVID made that 3 times as hard. Well, one thing I just want to mention, because I always try to think, what do the people on this call really want to hear? And one of the things, and maybe Tom and Bob can comment on this, it feels like there's no clearinghouse for our industry in terms of what's working for people during COVID. And I would love to see something where the best practices, and maybe Bob has an idea about this, but where these can be posted. And I'll give you a great example. About 6 or 7 weeks ago, we beta tested not only wearing masks in our community, but wearing masks and shields. And some of you may be doing this since day one, but we hadn't been up until maybe 7 weeks ago. And we beta tested at a couple of buildings, and when we did that, we saw our cases almost disintegrate when we wore a mask and the shield at the same time. And so we implemented it like 6 weeks ago, company-wide. And again, we went from about 40 some cases of residents to 0. And so I don't think that's a coincidence, because we did it in 30 some buildings. That's the kind of information that I'd love our industry to share, because that's a practice that although it's anecdotal, there wasn't a double-blind study done on this, right? But, it's anecdotal enough that, and a shield cost, 80 cents. So, and they're reusable. So it's one of those things that we can do as an industry to say, man, that may work. So I just want to share those kinds of things, because I want those kinds of practices. I want to know about them in an effort to get better.
I think that's a fantastic idea, Dwayne. We've certainly been trying to do that through things like our leadership huddles that you've participated in. But I think the industry could make a more concerted effort to do that. I mean, I think also like Fee Stubblefield and Springs and what they're trying to do with surface technology and kind of how you keep surfaces clean. So air, surfaces, wearing of shields. These are all areas where I know different operators are experimenting with different things to sort of see what seems to have the biggest impact. Also, in terms of what's at affordable cost and still brings you an impact, because obviously providers are having to consider that as well. I think it's a great idea. I think that also relates to the sort of challenge that or concern that you articulated, Ryan, and that is, won't there just sort of be a collapse and breaking point here? And I would say that when people work together as a team, as a family, as a team, the strength of those bonds enables them to get through a lot more and endure a lot longer. It's the key in the military, but it's key in so many different, it's key in marriages. And so I think it's strengthening those bonds between management and frontline staff, between basically leadership across different companies as they're facing challenges. There are a lot of providers now, Dwayne, you referred to this, who are taking a lead in how are they addressing the mental health of their staff at all levels and providing mental health programs, recognizing their staff is under enormous pressure right now and they need help. So, I think there are a lot of things like that that can be done. I'm encouraged by things I hear being done, but I think the broader sharing of ideas and kind of in that sense also helping to vet them, I think is because I think it's pulling together at a time like this, but I also agree with Dwayne, this is going to, there's just a lot of folks that aren't going to survive through this time. Because it's not something where, in January, everything will be different. It won't be. I think we're going to see impacts now for probably through most of 22 would be my expectation. We're going to see impacts on our sector. And so it's really going to be a matter of how providers have pivoted to address whether it's their frontline staff or whether it's their message to their customer.
Hey guys, Bob, I just want to let you know, I just heard that next week after the election, COVID's going away. Just wanted to make sure that you hear that news. Now, we're coming up on time here, and I just wanted to come in because we do have one question, and it was hit on a little bit, but maybe Alyssa too says, I know that Dwayne has set up a CNA school. How have folks been inspiring people to take up jobs that are not super sexy? Was the exact question. If anybody wants to take that, Dwayne, if you want to take that.
Well, I think,
or Tom.
I think people join companies, they don't join a job. And so, a lot has to do with the culture, the reputation, the brand, the opportunity, those kinds of things. And that we sell a lot of that, right? We have, I don't know how many recruiters that we have in the company, probably 25. And we sell the company, the reputation, the fact that we're the only company in the history of healthcare that's been voted a Glassdoor company, that we've been voted best company to work for 13 times. It's really the culture that our people buying into and the opportunity, the growth within our organization, how, one of our top general managers was a care manager 14 years ago. So I think those kinds of things help sell people that, yeah, your job this year may not be super sexy. That's not your job of a lifetime.
And I would just add briefly that folks, what really motivates folks in this field is the purpose of what we do and the meaning of what we do. And we've got a lot of folks in our front line are natural nurturers and caregivers, and that's what draws them to the field. And being a frontline CNA is an honor for a lot of folks, and they're happy to stay there in their career or advance, as Dwayne's example gives.
And I would just briefly say that, to Tom's point and Dwayne's, we're in the human connection business, but in addition to human connection, we're helping people at times either rediscover or reconnect with something that gives them a sense of purpose and meaning. The Japanese have a saying, ikigai, which means reason for getting up for breakfast. And it seems to me, we attract staff in particular that they're inspired by that. They're motivated by that. And the more we take care of them and the more we equip them, I think we can attract more and more people for whom they don't want a job. They want something that gives them a sense they're part of something bigger and they're making a difference in people's lives. Even if it's only one person that day, that one person, you have made a huge difference in their life. And I think some of our staff have discovered that when literally they've been the last person to literally hold the hand of someone who has not been able to be with their loved ones and has died in the community. And so I think there are powerful messages we can send. Don't think we've been very effective as an industry, especially in sending those messages.
You know, to add to that for a second, I think that, you know, Dwayne, I love your idea about this clearinghouse of ideas. One thing to add to it is, clearly it's important to be focused on some of the HR practices and ways to manage the virus. But let's not lose sight of the pressure on occupancy right now. You know, you look at the NIC, latest NIC data. You know, you look at some of the rationale of some large investment groups. Like it's in a challenging place, and it seems like we haven't hit the bottom yet. And I would also encourage that clearinghouse to have ideas around sales and marketing, around telling the story, around that value proposition during this COVID time. Which is perhaps longer than many of us hoped. We didn't have time in this particular dialogue, but I think we'd all agree that on the other side, both the consumer and the product experience will change or has changed. And the industry will have to grapple with that, and people outside the industry will grapple with it as the opportunities present themselves. And it's going to be a big deal. I think that's part of what Bob spoke about in terms of the experience for people that are healthy and younger, finding purpose and these extra chapters in life. So we may not have the bandwidth right now to tackle the immediate and the future, but ultimately we're going to have to, and the success of the field depends on it.
There. So I do want to get to one more question that we did have here, and it was from Grace with Rendeavor. She was saying in a recent study conducted, 87% of senior housing leaders increased their 2021 tech budget, but only 27% of respondents had a clear understanding and a plan. Do you have any thoughts or comments on how budgeting and planning, specifically around tech, will change in 2021 and beyond? I don't know if anybody wants to jump on that one.
Well, I think part of the problem may be thinking of it as a budget around tech. The issue is, what are you trying to accomplish? What's your game plan? For instance, as Ryan said, with occupancy, or what's your game plan if we're still going to be, as I think we are in 21, in a COVID environment? So there are going to be restrictions on what you can do in terms of group activities and in-person visitation. You may still have 14-day quarantine upon move-ins. So how are you trying to address that, and then think of the role of tech in that? I think there's a huge role in tech, but thinking about it as a tech budget is erecting another silo, which may have nothing to do with accomplishing your goals for 2021. And I do think tech, whether it's virtual consultations and telehealth, whether it's the ability to communicate, also to use a voice activated. There are many experiments that are very encouraging about involving seniors with voice activated communication. And so, you know, there's a lot out there. There are all these new programs and apps out there that are basically individualized exercise and engagement platforms and so on. So there's a lot of good stuff, but a company's got to decide, where is it weak? Where does it want to address? What's its brand? And then think about the role of tech. Otherwise, you're probably going to make bad investments, whether they're big or small. They're probably going to be wasted.
Yeah, I would just add to that you have to define in the next 12 months what your mission is. And at Aegis, our mission is to be the safest place on the planet for our staff and residents. Once you define that mission, then you reverse engineer how everything falls into completing that mission. And if tech, the molecule system or infrared or, whatever, scanning temperature cameras or whatever, if that falls into the mission, then you just have to prioritize which has the biggest benefit. But that's what we've done, is say, hey, we want to be the safest place, not in our industry, we want to be the safest place on the planet for our residents and our staff. And then whatever gets us there, we're going to heavily invest in.
And let me
Well,
just
thank you,
comment
Dwayne.
what many, to all the tech companies out there that got the newest, greatest thing. I hope you will come to providers and figure out what their challenges are. As Dwayne just said, what are their priorities? And then sell solutions. Don't just sell a new app, a new technology. That's not helping the provider. You're just cluttering his or her bandwidth. Sell solutions to real problems.
Thanks so much, guys. So we're coming up on time right now, and you know, excellent discussion. And I genuinely mean that. I think that we could probably just spend the next couple hours just talking with you all. But we got some more things coming up. So I do want to thank you for taking time, obviously today, to join us, and also for logging in for some tech rehearsals. This is all new to all of us. Bob, you got a early test run last couple weeks with your event. But thank you all. It really means a lot for, you know, to our audience, and obviously to us for the support. So thank you. Be safe, and hopefully we can bring you back to a live event sometime soon. But if we continue to do this, to continue this conversation. So we're going to now go to a few more commercials from our sponsors, and then we'll come back to the main stage. So thank you all.
Thank you.
Here at Eldemark, we've got you covered. Over the past 20 years, Eldemark has become the leading electronic health record and operational technology solution for the senior care industry, and for good reason. We don't offer piecemeal healthcare management solutions. Rather, we partner with senior living communities to develop a comprehensive, mobile-friendly healthcare, communications, and business operations software platform that saves you time and money while raising the quality of care that you provide. Give us a call today, or connect with us online to learn more about how Eldemark can help you improve resident outcomes, create workforce efficiencies, and further your financial objectives. Let us serve you as you serve your resident customers.
Hey Corey, have you seen Myron? We need to talk about SLIF.
No, I've just been working on our new nurse call catalog. I think I saw him talking to Jake.
Hi Jake, you have any clue where Myron is?
No, I don't. I've been taking care of the latest R-Care mobile updates. I checked with Katya.
Morning Katya. Has Myron been up here?
Hey Mike, I'm just doing some orders. I think Myron said he was going to be in the conference room practicing for SLIF.
Myron, are you in there? We need to start working on SLIF. What are you doing?
Practicing the banjo.
Myron, that's awesome. As a wannabe musician, we got to get you to come play banjo, maybe virtually or live at a future event. So right now is a moment for you all to stop listening to other people talk and actually be part of the conversation. So on the left-hand side of your screen, you'll see there's a networking lounge. That is random networking. You can go on, it's like roulette. You click a button and you'll randomly get paired up with somebody for a few minutes. You may run into an old friend, you may meet someone new. It's an opportunity that actually happens at live events, but it's kind of tough to pull off virtually, but it's some fun. So we encourage you to go there. If that's not your thing, you'd rather kind of just go in a group setting, you can go to the discussions. In the discussions, we have some themed rooms, one on hiring and staffing, another one on rethinking your value proposition, which is discussed. That is these are not facilitated. So it's an opportunity to go in, turn on your camera, and literally just talk to some industry friends. And as Rosemary put in the chat earlier, you can also create your own room, and these things can stay open on a topic that could be of interest to you and to hopefully bring other people in. So Rosemary Jordan had also set up another one there. So we're gonna do that just for the next half hour, and then we're gonna come back to the main stage. But before we do that, one quick note. Unfortunately, our final session of the day with Tammy Marshall from Thrive had to be canceled due to something that came up on her schedule. However, it's good to have good friends, Steve Moran being that friend. Steve Moran and Denise Scott are actually going to jump in and do a session that's just hot off the press research on how culture of an organization can actually influence occupancy. Obviously an important topic. So that's going to be replacing our last session. So with that being said, go enjoy some networking time, and we'll see you back here in a half hour.